These units were supposed to ease pressures on ambulances, but since being introduced over 2 years ago, they've mostly sat idle.
Get the low acuity patients transferred between the hospitals and perhaps the nursing homes or their homes, and getting the testing or the care that they need. And again, it'll free up the paramedics to staff the ambulances to respond to the emergency calls.
Former Health Minister Bruce Fitch said these multi-patient transfer vehicles would be operated by emergency medical technicians or EMTs, transferring up to 4 patients who are considered non-urgent to appointments or between hospitals. At the time, Fitch said about 50% of the transfers ambulances were making could be made by these vehicles instead. But since then, some have only made a handful of transfers. In 2024, the first full year these units were supposed to be on the road, the North didn't have a unit operating, but 4 transfers were made in the South, 28 in the West, which includes Fredericton, and 607 in the East, a number that shows what the unit can do. For the first 6 months of this year, the unit did 71 transfers in the North, just 2 in the South, 11 in the West, and 247 in the East.
That's why they haven't moved, is because there's nobody sitting in those vehicles to do the work. It isn't the fact that the work isn't there.
Chris Hood says it's a symptom of a problem that's plagued healthcare: staffing. Right now, there are about 127 vacant Ambulance New Brunswick positions, including EMTs.
In July of last year, the ambulance system was unstaffed, 57 vehicles on one August weekend. And that weekend would have, on average, about 80 or 90 staffed vehicles. So over half of their vehicles were unstaffed because of shortages.
He calls this idea fabulous, but it requires more work and coordination. Hood's hoping recent promises by the Susan Holt government to help fund paramedic and EMT training will see these units on the road more consistently in a few years' time. Laura Brown, CTV News, Fredericton.